Well, I think we're in an uncertain situation really, because we are unclear at the present time as to what guidance is available, which is going to assure the maintenance of these integral parts of the health service.
What are your fears in terms of mental health services and special education provision?
Well, our concerns really relate to the fact that we, as a trust, are a specialist trust providing mental health and learning disability services, as obviously others in other parts of the country. And our concerns are that the pressures of the day for the frontline acute services may make such demands on funding in the difficult times that lie ahead, that the funding which has come or which we believe should be available for continuance of mental health and learning disability services is still available. We are a foundation trust. We recognise that we're in a market situation, but I think that we need to also recognise that the health service as a market, as a whole, we need to safeguard essential services. I think what we're doing is we're looking for reassurances as we hear how GP consortia and commissioning is going to develop. We're looking for safeguards to assure that these services can be maintained in the future, whilst at the same time recognising that we are in a market situation.
So your concerns are less with who provides those services, but that they're maintained? Absolutely,
because it's about our belief that these are essential services, essential developing services within the health service, which have been improving over the last 10-20 years through varying national plans that have been developed, and we want to see the maintenance of the improvement of those services over the coming years. We did go through a time, years ago, when mental health funding was just mixed in the pot, and we saw major tranches of funding which just disappeared from mental health and got moved to build new acute hospitals. We just don't want to see those sorts of days return again.
How do you view the competition from any willing provider, from the independent sector?
We are happy with the competition. We're in the market. We believe that the best people should be providing the services, and we're already, as a foundation trust, involved in tendering for services, competing for services. And we're learning about that. Obviously, as foundation trusts, it's a relatively new development over the last 4 or 5 years, but we're learning and we are happy to compete with all sectors of the market.
So what pressure can you put on anybody to make sure that mental health services, which have grown to a better level, are maintained?
Well, I think that the first answer to that question is that we need assurance within the coming through from the new healthcare bill to assure that there are some safeguards built into the processes which are going to follow over the next few years. That can happen without, as it were, moving the market or shifting the market, and what we want to do is to just seek assurances which will help us and guide us as we meet with commissioners over the coming days.